afternoon, everyone. It's Joe McCarthy at Dell Tech Laboratories. It's a few minutes past the hour, so we'll get started now. I'd like to welcome you all to our webinar regarding the Health Canada COVID-19 interim measures. At the end of the webinar, we will have a question and answer period. As I mentioned, we have a full room today, so I expect we may have many questions and answers, and I'll try to run it as long as we can to make sure everyone gets their questions answered. So we're going to talk about the 4 main initiatives that have been introduced in the last couple of weeks by Health Canada to help respond to the pandemic and access to products that are required or people are needing to maintain health and hygiene. And that will include the importation and distribution of products that are not registered in Canada, but they may be registered in the United States, a mutual recognition agreement nation, which is most of Western Europe, or the PICS countries, as the Pharmaceutical International Cooperation Scheme, which is most of Europe, parts of Asia, and Australia. We'll also speak about the interim measures that were introduced to increase production of hand sanitizers and disinfectants in Canada, and also the new measures that were brought in for consumer cleaning products and body washes and soaps, and for workplace cleaning products as well. For the exceptional release of imported products in response to the demand for hand sanitizers and disinfectants, the Health Canada issued the Drug Establishment License Bulletin number 74, which would permit the import of hand sanitizers or disinfectants that are not registered in Canada, but are registered in either the United States, a MRA country, or a PICS country. To do this, you still have to import to a facility in Canada that has a site license for your natural health products, so those are your alcohol or isopropyl-based hand sanitizers, or to a drug establishment license. Those would be your quat-based, your chlorhexidine, or triclosan-based hand sanitizers. Reminder that hard surface disinfectants, for the most part, are exempt from GMP and establishment licensing in Canada. An exception to that would be disinfectants that are used as sporicides or to treat medical devices. Shortly after the issue of that one, Health Canada followed up with Bulletin number 76, which allowed for some relief or expanded use on the confirmatory testing that's required when you're importing drugs into Canada. Generally, you have to do a quality assurance test that would confirm identity of the active ingredient. Typically, this is using some sort of spectrographic, like an IR or UV vis, and also allowing the product to be shipped directly from the manufacturer in the US to a fabricator in Canada without having to quarantine it, and also defer when confirmatory testing is done. The next bulletin that was issued was relief from some of the testing for low-risk drugs. So no longer having to do identity testing upon receipt of the drug in Canada, confirmatory testing for finished product specs. And this was limited to low-risk products, such as and including our personal care antiseptic hand cleaners. So what you need to do for importing under these exceptional release forms, there is a form that has to be completed and sent to Health Canada, and that will include your company name and address, the company name and contact details of a Canadian representative responsible for distribution of the product, the drug establishment or site license number to the importing facility along with their contact information, the name of the product or the foreign registration number of the product in the country of origin, and the copy label that will be distributed in Canada. I'll talk about that label in a bit in a second. Port of entry, the date of entry, how many units, and lot numbers. With respect to the label that's going to be on your product, chances are these are not bilingual labels. These interim measures do not give you relief from the Quebec language laws that require French. So you can import to Canada, but Health Canada's got no jurisdiction over the provincial regulations that require French labeling in Quebec. You want to be aware of that and the potential issues that it might cause you. The next initiative was the second one. I think the one that most people are here for is the interim measures are being implemented for the domestic supply of hand sanitizers and disinfectants. So we'll talk about natural health product licensing and site licensing. some GMP considerations, your good manufacturing practices, and transportation. You have to remember your alcohol-based hand sanitizers are in fact flammable. So to sell a hand sanitizer in Canada, there's actually 2 licenses required. The first one's your product license. That's the license to sell the product or even just give it away. Alcohol-based hand sanitizers are registered as natural health products in Canada. Hand sanitizers based on quats or chlorhexidine, triclosan are all registered as drugs. Your site license is a license to package, label, or import the hand sanitizer, and I'll talk a little bit more about importation. Only a facility located in Canada can receive a site license or drug establishment license. When you're importing, the foreign manufacturer will have to be included in the annex to your Canadian site license or a drug establishment license. You got to remember that is for the physical location where the hand sanitizer is going to be manufactured or first received to. So natural health products require a site license, drugs require a drug establishment license. In the process, the first thing you have to do is request a company code. That's the code that the Natural and Non-Prescription Health Products Directorate uses to track submissions and projects. It is not an authorization to make or sell product, but you need that to put on your application forms to help keep things straight. When you request a company code, when Health Canada responds, you will get 2 emails from them. The first email will be identifying what your company code is. The second email will be from Canada Post, opening up what's called an ePost Connect conversation. ePost Connect is an online, secure, instant messenger, for lack of a better term. You would have to log onto that and open up an account. The account is free, doesn't cost you anything. But this is how you will submit hand sanitizer applications for both sites and for the products. When you submit your application, you want to use this heading, Hand Sanitizer COVID-19 application. The NNHPD is giving priority to products that are directly used in the COVID-19 response. This will get you bumped to the front of the line. They will look at it much more quickly. If you were to do a different type of product that doesn't really go to the issues we're facing today for COVID-19, it'll go in the regular queue. It would be processed within the Natural Health Products Management of Applications policy, which under normal circumstances runs between 60 and 180 days, depending on the class of submission that you've put in. Keep in mind, for the alcohol-based hand sanitizers, this interim measures only apply to the products that comply with the monograph for skin antiseptics. So your label will have to match the recommended use or purpose exactly as on the monograph. You won't be able to say things like kills 99.9%. You can't say it kills viruses. That is not a claim that's supported by the monograph. Our experience with this so far is that we're getting a company code within 2 to 3 days, and we'll get a license, either the product license or the site license, within another 2 to 3 days. So conceivably within 5 days, you'll have your licenses. I'm going to point out that the NHPD Health Canada has made absolutely heroic efforts on this. We have been receiving licenses over the weekends, including Good Friday and Easter Sunday. They're really making an effort to get these through as fast as they can. For NHP, for natural health products, your good manufacturing practice considerations, keep in mind on the interim measures, there is a interim cover letter that you're signing, and you're simply attesting that you're meeting the GMP requirements for your manufacturing, packaging, labeling, and importing. Under normal circumstances, you would have to submit proof of GMP compliance. This would include a quality assurance report, along with all your supporting documentation, your forms, your SOPs, test data, or if you were testing under, you had an existing drug establishment license. So you don't need the proof today, but you may in the future if you wish to keep your site license. Unless you're importing, if you're using a foreign manufacturer, that needs to be listed on your site license application. And our experience has been Health Canada is asking for the proof of GMP. So with a foreign importer, typically you're looking for something like an FDA establishment inspection report. On the interim measures, they'll also accept cosmetic GMP. So if you had a cosmetic GMP certificate, they also accept things equivalent to the Canada food safety regulations. So if that was site that was registered under the US FDA for food processing. But if you put in an application citing a foreign supplier without that proof of GMP, it's going to slow things down, and there are going to be questions about it. You have to keep in mind as well, the site license that gets issued on the interim measures will remain valid only during this pandemic response. Following this period, if you want to keep your site license, then you'll have to put in the supporting information for GMP, including the quality assurance report, SOPs, and forms and documents. The interim approach has been published as being in effect until March 31st, 2021, or until a notice is issued that the interim approach is being terminated and finished. What we'll likely see is Health Canada will send a notice to everyone, all the license holders, advising them that the interim measures are coming to an end by a certain date. After that date, you have to stop producing under your temporary site license. So if you have any existing stock and product, you'll be able to sell through that. For those who are new to the game, the GMP is actually a very extensive quality system. The site license isn't kind of like getting a fishing license or a driving license where you could just go and start doing things. It's fairly robust and requires a lot of paperwork and documentation, and addresses everything from receipt of your raw materials through production of the product to finished product release, record keeping and tracing. So you would need processes and procedures for your premises, your equipment, your people, sanitation, recall reporting. I've given you the link here to the GMP guidelines. It's fairly extensive, and I will strongly recommend you take a look at these before you sign up to see if that's something that you are doing or capable of doing. The other issue is because of the very high demand with NHP products, the expectation is that your medicinal ingredients are a pharmacopoeial grade, so your ethanol and your IPA. Of course, because of the high demand globally, not just in Canada, these are becoming harder and harder to get. So Health Canada has actually issued a temporary opinion on the use of technical grade alcohols. And part of that requirement is that you would have to submit the specifications to Health Canada for them to review and assess what the risk is. They then publish on the website the name of the company and the grades of technical grade alcohol that are being accepted for use. And then you have also additional label requirements if you're using that grade, including this warning, or not warning, but advising the consumer that it's technical grade, additional requirements that the label says for adults only, don't use on open broken skin, don't use if you're breastfeeding, do not inhale, and a phone number to report adverse reactions. Also, in response to the crisis, Transport Canada has issued what's referred to as temporary certificates. They realize that not everyone who is getting a license to make hand sanitizers under these interim measures was necessarily handling or transporting dangerous goods before the crisis. So with this temporary certificate number TU 752 points out a number of not really exemptions, but considerations based on the product size. So if your individual containers are less than 5 liters, you'd be exempt from Part 3 documentation, which means you don't need a shipping manifest. Part 4 is your safety marks, which are really the labels of the placards. You would still need the Class 3 flammable liquid symbol, but you don't need the UN number beside it on the outside container. There's also an option to replace the symbol with one of 3 pre-approved statements regarding the hand sanitizer and flammability. It also exempts you from the means of containment. You would not need UN spec packaging when your individual container is less than 5 liters. This is very similar to the limited quantity exemptions. Similarly, you don't need training. And then reporting requirements, that's the reporting requirements in the event of a spill. If you up your size between a 5-liter container and a 30-liter container, these are the individual containers. So if you're shipping like a pail or a large jug, similarly, you are exempt from the shipping manifest. Similar considerations for your safety marks. So you would need the flammable liquid symbol, but you don't need the UN number. But you are not exempt from the packaging requirements. If your package is between 5 and 30 liter, that still needs to be UNTDG spec packaging. You have a similar exemption for your training requirements and from the emergency response. And then finally, if you're shipping containers that are larger than 30 liters and less than 450 liters, you still need a shipping manifest, but there's specific requirements on the content, and you are not exempt from the safety marks, the labeling, the requirements for TGG spec packaging. You're not exempt from training requirements or from reporting in the event of spills. And I also want to point out the temporary certificate is not a complete exemption from transportations of gauges, goods regulations, or all the sections noted above, parts 3, 4, 5, 6, and 8. You still need proof of classification under section 2. Specifically, you should be looking at what is the flash point of your product, because that's going to define whether you're class 3 packing group 2 or class 3 packing group 3. The final note I'll leave you with if you're going to make the hand sanitizers is keep in mind the interim measures are strictly for personal domestic use products. The idea being this is what you and I would buy at the drugstore or the grocery store and bring home. Personal commercial use products are slightly different. They would not go under the monograph, though you could cite the monograph for safety efficacy, but there were some additional labeling requirements. But on the interim measures, if you want to sell your monograph approved hand sanitizer to a healthcare setting or hospital, clinic, something other commercial, you have these additional requirements that you have to notify Health Canada at this email using that subject line, COVID-19 product notification. And then in the email, give details on what your product, the product name, your NPN number, and your intended distribution. I don't think you have to get as specific as which hospital or which healthcare facility, but point out that you are distributing to, say, a local hospital or some kind of healthcare clinic or a senior care center, that sort of thing. So moving to the second half of that was about the domestic supply of disinfectants. The rules haven't changed too much. You can get a disinfectant that complies with the disinfectant monograph because that does not include indirect claims against COVID-19. It won't get processed at the front of the line. You could still get say a quad-based monograph disinfectant, but it's still going to take the usual amount of time. If you have a product and you have data that would support indirect claims against COVID-19, and we've detailed what those requirements are, you could get that in. We would note it as a COVID-19 application, so it gets bumped to the front of the queue. And we're seeing that these have been turned around in about 30 days, where normally it would take almost 12 months. But the interim measures don't exempt you from the fees. The submission fees still apply, so it would still be, as of April 1st, was $5,712 for a full disinfectant review. So you would need your basic bacterial and fungicidal data as well as your virus data to make an indirect claim. And it's this additional data that would allow you to be on the list of approved disinfectants for COVID-19. If your product was only ever registered under the monograph, it does not have the claim support to be included on the list of approved products. The third initiative that's come out recently is interim measures for consumer cleaning products and body and hand washes. And what this will allow people to do is to import and sell products that don't fully comply with the labeling requirements of the Canada Consumer Product Safety Act and the Consumer Chemical Container Regulations, CCCR, and the Food and Drug Act cosmetic regulations for your hand soaps, body soaps, that sort of thing. So what it will do is allow you to import product that maybe it's only in one official language. So it's either English or French. And keep this in mind for all these interim measures, you still need the label to be at least in one of English or French. You couldn't import a label in a third language. It's still official languages, but they are allowing you to have one or the other. Perhaps there's hazard symbols missing because the Canadian requirements under the CCCR regulations We use a lot of symbols. You don't see that under the Consumer Product Safety Commission regulations of the US, or if you're importing from Europe, there might be different hazard symbols, because under the CLP in Europe, they're closer to a GHS type label. And of course, the Canadian regulations are very prescriptive on what your safety and cautionary language has to be, depending on the hazard class of the product. Under the US regulations, you have a little bit more latitude and freedom on how you word that. And also how ingredients are listed on the label. There is a requirement under the consumer regulations to list ingredients that contribute to the hazard of the product, and our cosmetic regulations have specific requirements on how you list what the contents are. Point out though, the interim policy doesn't absolve you or relieve you from some of the larger issues under the Canada Consumer Product Safety Act. So products, if they have a flaw or an issue that is likely to cause injury or death, but also more specifically packaging requirements, including child-resistant closures, where under the chemical and consumer container regulations, CRC child-resistant closures are based on the hazard, whether it's toxic or corrosive. Under the US Federal Hazardous Substances Act and Poison Prevention Packaging Act, it's based on content, certain chemicals at certain strengths. So conceivably, a product that is packaged correctly for the US would not be compliant for packaging in Canada. Also for different prohibited ingredients and components in Canada as well. So what the policy refers to is products are used for cleaning, basically, not to make things look good. So yes, an all-purpose cleaner, a toilet bowl cleaner, a floor cleaner, not a furniture polish, not a steel polish, something that just is more of a cosmetic issue. Similarly for laundry, it's dishwashing. It's about cleaning the clothes or cleaning the dishes. So what would not be included is something like a fabric softener or something just simply adds fragrance. I would even put in like a whitener or a brightener. That's just supposed to improve the appearance of things as opposed to actually perform, a function of cleaning. With your hand and body soaps, they're regulated as cosmetics, usually to clean the skin, but these don't include drugs or natural health products that would be registered with a similar function, your cosmetic-like drugs. And also not for products for cleaning the skin is not the main function. So there's no exemption here for, say, cosmetics, nail polish, anything like that, that would be a cosmetic. And similarly, the interim measures, as I mentioned before, and I'll repeat again, don't address Quebec's provincial language requirements or the Competition Bureau and Federal Language Act to have bilingual labeling. They'll allow it here, but perhaps in other jurisdictions, you might have a risk, but I'd be a little incredulous that they're going to enforce it at this time. So what you would need to do for these consumer products, there is a form that would have to be completed. You submit a copy of the label that will be on the product. This would be the existing label from the foreign country with the form. And then you also need to submit a copy of what the Canadian label text should be. So you don't need a mock-up, text only, just print, no symbols, no advertising or marketing. You don't have to make it look pretty. And that also has to be published on a website. At the time that I put this together, the requirement on the form says you would publish it on a website and you provide that website to Health Canada within 48 hours of submitting the form. I do have some notification that Health Canada was going to change that it would be published on a website within 20 days of submitting the form or prior to first selling in Canada, whichever comes first. As of yesterday, the website had not been updated with this new information yet. Also with that URL, what they mean is that that's a direct link to where the label is. It would not be a link to your company website. They shouldn't have to go looking for it. This is really for the benefit of Health Canada. I don't think there's any expectation the public would go looking for this. Similarly, this will remain in effect until 3 months after all provinces and territories have ended their states of emergency. There is a similar program that was just announced on Monday for cleaning products used in handling storage in the workplace, so your WHMIS regulated products. It will permit the sale and importation of the products that don't fully comply with the Hazardous Products Act and regulations, or the Hazardous Material Information Review Act, which is your trade secrets on an SDS. And the note here I've highlighted from the US, this is specifically for workplace products coming from the US. The interim measures for consumer products had no qualification on the country from origin. The only issue was that they may not have bilingual labeling, or they would have different symbols and phrases. So part of what they're going to allow for the workplace products is your label and or safety data sheet may be in only one official language, English or French, where of course under the Hazardous Products Act and regulations, you're required to have both bilingual labels and bilingual SDSs. The necessary pictograms on the label might not be exactly what's required by the Canadian regulations, and some of the hazard and precautionary information on the SDS label doesn't match the Canadian regulations. So to recall, particularly for the US under the HCS 2012, the OSHA regulations, they embedded the GHS revision 3 wording into their regulation, where under the hazardous products regulations in Canada, we incorporated by reference GHS revision 5 wording. So there are some nuances on some of the precautionary first aid statements that don't align 100%. So similarly, this interim policy applies to cleaning products again, so just things that are used to clean surfaces, remove soil, but not to products whose primary use or only use is a cosmetic or an appearance-based. And that applies to your laundry and dishwashing detergents too. It's supposed to be for cleaning. It's not for fabric softening. It's not to make things look good or smell nice. So what you need to do to import those products, Health Canada has a form specific to workplace products. You would also have to make available on your website the SCS and label text as it should appear for Canada. You don't have to have mock-up labels though. You would complete that form and submit it along with the existing label with your bilingual label text and your bilingual SDS within 20 days of submitting your form. If you look on this, what's different from this for the consumer products is there's no requirement to put this on a website anywhere or provide them a URL to do it. And then you submit the form with the client SDS and a Women's 2015 label to this email address. And similarly, these interim measures will, and 3 months after all provinces and territories have canceled their states of emergency. So what Dell Tech can do to help you, if you're looking to get a hand sanitizer or a hard surface disinfectant registered, we can help prepare and put those together for you. We are already registered with ePost Connect. We know what the right forms are. We can help you prepare a compliant label and get it done right the first time. If you need testing for TDG, of course, we do flashpoint testing as well. We do corrosion, but that shouldn't be an issue for these types of products. For the consumer and workplace products, even though you wouldn't need a compliant label or SDS on your product, you need to give one to Health Canada, and we can help put those together for you if you don't have it. And similarly, for your trade secrets on your safety data sheets, if you don't want to give that information to Health Canada, which is one of the requirements, we can get you your trade secret registered, and you can get that within 5 to 10 days. Okay, the first question I have is, when filing for a site license for import, is the site license applicant required to include GMP evidence, QAR, drug GMP audit for each of the foreign sites involved in manufacturing, packaging, and labeling? And I'm saying yes. So the ones that I've done in the last 2 weeks, if the client didn't have information, I would advise them to get it. Some of the information that they did have, it was deficient. It triggered questions from Health Canada. But absolutely, the problem is Health Canada has no jurisdiction outside of the country. So if you're a domestic manufacturer, they could show up on site and have a look if they have concerns. If you're importing from overseas, they have no access to it. They can't do anything. So my recommendation is absolutely you should be submitting evidence to GMP for your foreign manufacturers. And that could include a drug GMP audit, an FDA establishment inspection report. QAR you can do, that might get looked at quite closely. depending on who filled it out, how complete it is. I don't think it's enough to simply check the boxes on that form. You want to have the supporting documentation. And particularly, you would have to look at, depending where you're shipping from, is that information in English or French? You may have to get it translated. We can't submit forms in a language other than English or French and expect Health Canada to be able to read it. Next question was, for interim disinfectant products are being allowed to export into Canada, have you heard anything in terms of how they manage the products that are already in Canada? I'm not sure I understand that question. If the sender would like to email me directly and I see if I can help you out. Imagine if the product's already in Canada, you've kind of gotten through the gate. That's part of the issue when you submit these forms. That allows Health Canada to coordinate with the Canada Border Services Agency. So if things are being imported, they're being imported as a hand sanitizer, that's considered drug and HP, and they're looking at where it's being shipped to, and does that person have a site license? I do, unfortunately. I've spoken to a number of people in the last week or two. They ordered product before they were aware of what the situation was, and their product's being held at the border, and they don't have a license. The product's not being released. My understanding is you still have to pay for the storage on that. If you got a container sitting in the Port of Vancouver or Port of Montreal, that's not free, and the CBSA won't release it because it's a health product and it's not going to register site. Now let's keep in mind this is about hand sanitizers, and drugs require the importer to have a site license or drug establishment license. This would not apply to hard surface disinfectants. Those are exempt from drug establishment and GMP requirements. So if the importer establishment can just be an office, can I use a rental storage facility? I don't want to say no, but your site license wouldn't be for your office. The site license would be at the rental storage facility. And then could you practice the GMP that would be required for importing? How do you know, what are you doing to release the product? That's part of what GMP is. You get a shipment in and you have to confirm, did you get what it was supposed to be? Is it labeled correctly? Is that right contents? Do you have the C of A or certificate of compliance from the original manufacturer? I think it would be challenging to do, but at the end of the day, it's a building. Arguably, it's you have to look at your HVAC system. Is the product stored correctly? It's not exposed to the weather, but there'd be a challenge to do it. When is the COVID-19 under control? $1 million question. I don't know. We're going to have to wait for the Public Health Agency of Canada and or the premiers and prime minister to declare when the crisis is over and when they start to open things up. But declaring a state of emergency is a formal legal definition. And similarly, there'd be a process under which the provincial and territorial governments would have to follow to end the state of emergency. Because simply declaring a state of emergency also allows the government to do certain things like restrict events, closing restaurants, opening up the bank and the cash flow, that sort of thing. So it's not just a statement of affairs. The next question is, if we have a temporary site license to manufacture an alcohol-based hand sanitizer, we need to apply for a separate one for a clot-based hand sanitizer. Yes, that is correct. So a clot-based hand sanitizer is considered a drug, and that requires a drug establishment license. That is an interesting question because similarly, your drug establishment license are not exempt from the fees. I'm not sure how quickly the inspectorate would be able to come out. Traditionally with the drug establishment license, they do physically come on site before your license is granted the first time. Unlike natural health products have always been a paper audit. It's rare that they come and inspect the facility. So with your clot-based hand sanitizer, that's a much different beast. It's a much bigger project, the GMP for drug establishment licensing. Also keep in mind that your drug establishment license can be quite expensive. The base fee is $27,000 a year. You can get a reduction based on actual sales. But I haven't spoken to anyone yet who's tried to get a DEL in the last 2 weeks with respect to a clot-based hand sanitizer drug, and I think that's part of the issue. is the cost and the much higher level of paperwork and documentation. Actually, and this might be the key question for you. For a drug establishment license, the person in charge of quality assurance has to have the training, education, and experience, and they also have to hold a university degree in a science. So you might want to look at what you have for resources, who your staff are, and see if it has anyone to fill that role of quality assurance. Next question was, if we manufacture a product with an EPA number, can these be sold in Canada? Yes, they could, and that would be under the first measure that we discussed, the exceptional release, where you would notify Health Canada, the form to complete, you email to them along with the existing label and how many units. So if you have an EPA registered disinfectant, you can do that through that first process, the expedited release. Question, do you have a facility in Canada in order to obtain a DIN? Does that facility have to be approved by Health Canada to be a GMP facility? Yes. If you're going to manufacture or import a drug, a DIN, you need somewhere in Canada that is has a drug establishment license to do that, and it needs to be approved by Health Canada before you do it. The next question is, does a copy of the proposed label for domestically manufactured hand sanitizer formulations need to be submitted with the product and site license applications? The answer to that is yes as well. If you were to, or when you complete the electronic product license application form, there's an option on that to have it auto-generate your label based on the monograph or submit the label separately. I will strongly encourage you to have the license application form auto-generate your label. That way, you don't have to be concerned about missing something, making a mistake, or adding claims that you can't make under the monograph, like kills 99.9% or kills viruses. That'll make sure things go through quickly. If you do submit a label on your own that doesn't meet the monograph, if the NHPD has concerns with that, you'll receive what's called an information request notice, which is one of those heroic measures they're doing to help you out. Under normal circumstances, if you made a compendial submission and your label wasn't exactly correct, the application is simply rejected and you have to try it again. But we have seen in the last couple of weeks, if the label has a minor issue with it, they give you an opportunity to correct that. The next question is, if we already have an NPN DIN number for a hand sanitizer, are we allowed to change the supplier of the alcohol, SDA 200 proof, and not tactical grade, a rheology modifier? A qualified yes. So you can change the supplier of the medicinal ingredient as long as the medicinal ingredient still meets the specifications that you submitted or meet the NHP requirements. So they don't really care who you're buying it from, just as long as what you're buying meets the specifications. Similarly, for your rheology modifier is a non-medicinal ingredient. You could change suppliers. You can even change the grade of it if you wanted to. It's a simple notification to change NMI. So if you wanted to switch, say, from something like the carbomer to a methyl cellulose, there is a notification form you would submit. In strictly reading the Natural Health Product Regulations, you simply notify and do it. You don't have to wait for an approval or acknowledgement from NHPD. But I know from experience, NHPD would prefer or assert that you did in fact have to wait for them to acknowledge it. I've done a couple of those in the last couple of weeks, and those are being turned around quite quickly as well if it is specifically for a COVID-19 product. The next question was, do you know if a hand sanitizer, NHP, with evidence against COVID-19 and or a viral surrogate will require a full class 3 submission review timeline, or if this review is expedited? The answer is yes, you would have to put in a class 3 submission and review with the data. Would they expedite it? I think they would. But you keep in mind your class 3 review timeline, I believe, was 180 days. Depending on your efficacy data that you put in, I wouldn't be optimistic that you'd see it turn around in 2 to 3 days, but I definitely think there's a possibility they'd probably do it in a couple of weeks. I would invite you to take a good look at the human use antiseptic guidelines that talk about what efficacy is required. So you would need your base bacteria and fungicidal data, as well as your base virucidal data, in addition to whatever surrogate. I don't know what surrogate that they are accepting for human use hand sanitizers to make an indirect claim against COVID-19. Next question was, if I would like to dilute foaming hand soap with raw material from the US, what do I need to do? I would need more context on that. If the person that submitted that question would like to contact me directly, I think I could help you with that. If we buy from Canada and want to sell hand sanitizer in Canada, do we need a license or NPN? Qualified, no. So if you're buying a licensed product, at that point, you're only a distributor. So the onus is on the person who made it and labeled it to make sure that they had a site license to make it and that they have a product license to sell it. Now you're just a distributor or retailer. There shouldn't be any onus on you for a license. What if the viscosity change with the change of supplier? If you're changing the viscosity of the product because you change the supplier or the raw material for a natural health product, that's only a notification. I'm going to reach out to our manager of regulatory affairs, Terry Dickinson, to get her opinion on DIN. I do believe that's an amendment that you would have to submit. It's a post-license change. There'd be a base fee with that, but that's more of an administrative issue. You can do it, but there's just the forms that you would have to fill out. You couldn't do it on your own. There's definitely something you would have to submit a new form 3011 for the DIN and put it in. The question is, once you have a site license application, can you receive product with the NPN and repackage it for the NPN holder? Yes, you could. So your site license application would include whether you're a packager or labeler. So if you're receiving product in bulk from someone else, they would still have to have a license to manufacture it. Now you're the packager and labeler, so you have to make sure that it's labeled correctly. There'd be finished product specifications because now you're taking it from, say from a tote or drum, and you're putting it in small bottles. But that would have to be part of your site license application. And generally, I don't think I've seen anyone apply for a license where they're only a manufacturer and labeling and packaging and labeling is being done by somebody else. So how do you apply for a site license if needed? If I could go back, we gave a summary here on slide number 9, but you have to contact the non-prescription natural health products directorate to get a company code. When you receive the company code, that's something that you put on the forms for your site license product license application. If you haven't done it before, I would recommend or I'll suggest that you contact me directly and we can help you make sure that gets done correctly the first time. My next question, I'm looking to import liquid sanitizer in bulk from the US and selling it to a Canadian company who will bottle, label it, and sell it under their brand and NPN. Who requires a site license? Manufacturing in the US, me as the importer reseller, or the bottling company selling it? All of you need a site license. So you as the importer would need a license to import the product in bulk. The bottling company would need a site license as a packager labeler, and you would need the US company listed on your site license to import the product, and ideally that manufacturer in the US would be registered with the US FDA. There's a question, we can just start selling. Not enough context to me on that one. I would say without a license, no, you cannot start selling. It's similar to a previous question for importing hand sanitizer, can the established license be an office or can we just rent space at a warehouse? Qualified, no. Qualified, yes. The GMP requirements include things like your premises, so you'd have to look at, does your warehousing have heating and cooling? How do you know the product won't freeze overnight? Or if this is still unfortunately going on in the middle of July and August and heat up. Really, your site license is not simply a license to do activities. There's a lot behind the scenes on your quality system and your procedures to do it. You could put the warehouse address on your license, but remember, the attestation form is you're signing a legal document attesting that you are playing by the rules. If there was an event or an incident and Health Canada follows up with you, then you would have extreme risk and liability. So I would not be comfortable simply using a warehouse as your establishment. I don't think you have control over that. I don't think you can necessarily maintain the conditions and be assured that the product will be maintain its quality. The question is, I want to change the pH adjusting chemical in an alcohol hand sanitizer. How do I get Health Canada to initiate the e-post conversation? If you have already registered your product, you would submit the notification to change the non-medicinal ingredient using that same e-post conversation. If you have not registered a product, then your first step is to apply for the company code. And it's in response to that that Health Canada would initiate the e-post conversation. But it sounds like your product should already be registered because you want to change the pH adjusting chemical. So that initial conversation is where you go back to. And what is the best way to contact me about hand soap? Email. I answer all emails. Phone's been a challenge because of the volume of work. I am working remotely as well. But if you have questions, I'll go back a slide. Here's my contact information if you want to either email me or call me. And this question, is proof of GMP required to obtain a DIN number for a surface disinfectant following the monograph at this time? No. Hard surface disinfectants are exempt from the requirements for drug establishment licensing and GMP. They have published a manufacturing guideline if you want to look at, but it is not a requirement. And the question is, I would like to import an FDA-approved hand sanitizer from Turkey. I have an FDA number, but no FDA report. Is that okay? I think you can, and that would be under the first program that we spoke about at the start of the webinar. This is your expedited release where you notify Health Canada of the product. So you notify the product name, label, where it's coming from, what port it's coming in through, the registration number. You also mentioned it's from Turkey. So if Turkey is a PIC nation, I believe. So if it has registration approval with the equivalent agency to Health Canada in Turkey, and the name escapes me at this time, that'd be another way to do it. But you could conceivably use it under that exceptional release. But as I pointed out, your label would still need to be in at least one of English or French. You would not be able to distribute a label that is only in Turkish. So our next question is, for hand sanitizers, can a DEL apply for NPN if there's MSDS and GMP and CE certificate? Is that adequate? Part of the question here, you have to figure out what is the medicinal ingredient in your hand sanitizer. If it's alcohol or IPA, your natural health product, and you need a site license and natural health product license. The SDS won't help you much. SDSs were never intended for hand sanitizers, and they don't disclose the entire product composition, nor do they establish GMP. The CE certificate, additionally, is about hazardous materials. That has no bearing or support with respect to good manufacturing practices. The product may conceivably meet the Health Canada monograph, but that's the sort of thing we'd have to look at a bit closer. I'd have to see your formula on that one to give you a more accurate or complete answer. So I see no more questions. So I'd like to thank everyone for their times. I hope everyone stays safe and healthy, and remind you that this will end. This does come to an end at some point, and it'll be nice. Resist the temptation, at least in Southwestern Ontario, coming this weekend, 20 degrees and sunny. It's going to be hard to keep your distance from everybody, but I hope everything works out for you, everyone. Thank you and goodbye.